today's PowerPoint is going to be on stem cell therapies. And there are some objectives to this PowerPoint, and those are to have a full understanding of what exactly stem cells are, the history of stem cell research, understanding how stem cells work, learning about diseases that can possibly benefit from stem cell therapies, and possible barriers that come along with stem cell research. And there's going to be questions at the end that are going to summarize the PowerPoint. So for a quick introduction to stem cells and stem cell therapies, there are many diseases that we are still struggling to cure. Parkinson's, Alzheimer's, diabetes, and different types of cancers are all examples of these incurable diseases. These diseases can be deadly or greatly affect the quality of life in thousands of individuals worldwide. These therapies offer a lot of hope for the future advancement of medicine and addressing diseases that many have struggled with for years. There's no cure for cancer or many other disorders or diseases, but finding treatments that could aid in fighting a disease that doesn't completely degenerate the body and one's quality of life is a step in the right direction. So for just a continued introduction, stem cell research is advancing and progressing greatly each year. Stem cell therapies are very promising for the future of medicine. Stem cell therapies can also be referred to as regenerative medicine, which is the possibility of a cell-based therapy to treat a disease. Now we're going to get into the history of some bone marrow stem cell research. So there's a decently extensive history of stem cell research and the advancements that have been made. Some of those in bone marrow include in the late 1960s, it was 1968, the first bone marrow transplant begun and took place in an individual with immunodeficiencies. In 1975, the first successful transplant in a patient with lymphoma. In 1982, the first transplant for an inherited metabolic disease. In 1992, an autologous BMT was used to treat breast cancer. In 1999, the first sickle cell patient transplanted using a non-myeloablative allogeneic sibling transplant. In 2010, there was the first human trial of marrow stem cells and stem cells that repaired mucocutaneous disease. So now we're going to go over some history of embryonic stem cell research. And there's quite a few of these as well. Embryonic stem cells are pluripotent stem cells derived from the inner cell mass of blastocyst, an early stage pre-implantation embryo. And in 1981, Martin Evans of the UK was the first to identify embryonic stem cells in mice. In 1997, Ian Wilmot unveiled the first animal clone. In 1998, James Thomson and John Gerhardt began to isolate human embryonic cells and grow them. In 2005, Woo-Soo Kang came up with his own technique to cloning that was very similar to Ian's in 1997, but his technique was specifically for matching a specific person. However, later on that year, they ruled that his claims were false. In 2006, there was a way made to create embryonic-like cells without the actual destruction of an embryo, which induced pluripotent stem cells. In 2010, the first medical treatment for a spinal injury derived from embryonic cells. So now we're going to go over a little bit about what is a stem cell. A stem cell is a cell that has the ability to divide continuously, and it's able to differentiate into many different kinds of cells or tissues. Stem cells have three different properties, and these are that they're unspecialized, they can give rise to specialized cells, and they're capable of dividing and renewing themselves when we touch on the unspecialized aspect of stem cells, we're meaning that they don't have tissue-specific structures that allow for specialized function. And when we're talking about that they can give rise to specialized cells, we're talking about differentiation, which means that these unspecialized stem cells give rise to specialized cells in response to external and internal chemical signals. And some of those internal signals are specific genes causing differential gene expression, and some of the external signals are chemicals secreted by other cells, such as growth factors. When we discuss that they are capable of dividing and renewing themselves for long periods of times, we're talking about, that they are unlike any other type of cell. So like nerve cells, blood cells, muscle cells, none of those can replicate themselves. So this makes them a little bit different than those. Now there's a bunch of stem cell types, and we're going to go over those as well. We have unipotent, and those can only produce one type of cell, like a muscle cell or a cardiac cell. Then we have the oligopotent, which has the ability to differentiate into a few types of cells. There's the multipotent, and this has the ability to differentiate into multiple specialized cells. We have the pluripotent, and these have the ability to differentiate into almost all types of cells, from intercell massive blastocyst is an example. And totipotent is the ability to differentiate into all types. Now for stem cell therapy, we kind of need to know what stem cell therapy is, and it is used to treat or prevent diseases or conditions. Stem cell therapy is a form of regenerative medicine designed to repair damaged cells within the body by reducing inflammation and modulating the immune system. This phenomenon makes stem cell therapy a viable treatment option for a variety of medical conditions. Stem cell therapies have been used to treat autoimmune diseases, orthopedic conditions, traumatic injuries, with studies conducted for Crohn's disease, multiple sclerosis, lupus, COPD, Parkinson's, and so many more. While stem cell therapy does not necessarily provide a cure for these conditions, the premise is to allow the body to heal itself enough to mitigate the symptoms of the conditions for long periods. In many cases, this effect can increase the quality of life for many patients. The goal of stem cell therapy overall is for self-renewing cells. To create new cells can possibly replace a damaged or diseased cell or area with low risk or side effects of rejections. Stem cell therapies are on the rise, but they're not completely established or to an established stage. Now we're going to go over a few barriers to stem cell therapies. So a lot of these can be expensive. They're still experimental, and there are a lot of controversies when we're dealing with these types of therapies. So there's a lot of promise for them, but a lot of them can be, like I said, expensive. And a lot of the reason for that is insurance may not cover certain aspects of it or the whole treatment in whole, which can really up the bill for those. Some examples, we've already listed a few, but these are kind of the most popular ones and the most commonly discussed, diseases that these therapies can be used on, and that's Parkinson's, spinal cord injuries, Alzheimer's, heart disease, cancers, and diabetes. And I think everybody, could probably pick one or more people in their lives that has one of these conditions. So these are serious conditions that need to be addressed, that address a wide range of people. For Parkinson's, a way to treat Parkinson's with stem cells, they could, where new cells could be used to repair and replace damaged tissue. That's what they're used for. Scientists have been able to turn stem cells into dopamine-producing nerve cells, the type of brain cells affected in Parkinson's. For the spinal cord, the transplant of stem cells into the spinal cord can repair damaged cells, promoting new growth and healing that could improve the injury. So there have been studies in animals that have shown that a transplantation of stem cells or stem cell-derived cells may contribute to spinal cord repair by replacing the nerve cells that have died as a result of injury. And this is preventing the spread of the injury by suppressing the damage inflammation that can occur after the injury. So now we're going to talk about Alzheimer's and how exactly it can address that. So stem cell therapy is a unique approach to treating Alzheimer's disease. It involves the systematic introduction of stem cells into the body via IV. When introduced in large quantities, these stem cells can find inflammation within the body and repair it. So for heart disease, bone marrow stem cells are used to improve heart failure or heart attack patients' cardiac function by renewing the damaged cardiac cells. So we're seeing throughout all of these that they're renewing damaged cells, and that's what makes them so progressive and different from other sorts of treatments. During a heart attack, cardiac tissue dies, weakening the heart. In the response to the diseased heart, stem cell treatment revealed development and growth of new blood vessels along with new heart tissue as well, which is huge after a heart attack or any kind of issue that's going to destroy tissue. So for cancer, they don't typically directly target cancer, but in turn can help with the recovery. So it encourages the production of new health cells after a number of cells have been damaged due to radiation treatments. For diabetes, stem cells can be trained to become pancreatic cells that in turn secrete insulin for individuals with type 1 diabetes. So in conclusion, stem cell therapies are very promising for the future and the future of medicine, but much research is still needed before these therapies can be used with complete certainty. Guidelines are necessary for ensured research processes. So some questions to kind of wind down and go over the entire PowerPoint is we should know the 3 properties of stem cells, the different types of stem cells, the barriers to stem cell therapies, and what the examples of diseases are that stem cell therapies can help, and how exactly do they help.